challenges you faced in getting into recovery?
I would say the challenges for me was the main two big challenges. One is for me, I had to make the space between the trauma that was causing me to have to recover. I'm constantly in recovery. Um, and let's see, finding someone more relatable to help the understandings and the guidance that someone would give me from my experiences, that's very hard to find. Someone that could understand, someone that's more relatable. And me being a person of color and the communities where I'm from, that's a very hard find. That's a very hard ask to find a professional to have that understanding.
Yeah, it seems like what you're really hitting on here is the need for representation within these behavioral health peer support spaces, right? So that when you need help and you need support, you're getting help by people that look like you, that are from your community, and can relate, to the unique circumstances that you find yourself in. Yeah,
Correct. Correct.
right on. What are some of the other challenges that you faced during that journey?
I would say constantly being triggered and re-traumatized, because in the process of searching for that support and not finding the correct support, it's triggering. It's very traumatic to have to explain your story over and over again and still not receive the support you need. That just really triggers, re-traumatizes, and to go throughout my day and wake up to have to do it again. That's more than a challenge. It starts to mess with you mentally, and so there's all sorts of support that comes into play when you need housing, food, shelter, and now your psyche is being tested because you're not getting the correct support you need at the right time.
Absolutely. I know in the recovery field, we talk a lot about the window of willingness for change, right? And so
Hmm.
when you don't have those available support services available, when you need that change, for your community, you're lost, right? And that can further exacerbate negative outcomes for communities that need more support, right? So I really appreciate you touching on that. Well, beyond anything else, what did you find was the most helpful in navigating through your recovery journey?
I would say the most helpful thing and navigating thing for me was to eventually find um, a path for me to express what I had gone through. It wasn't an opportunity for me to find the correct support. It was an opportunity for me to express what I've been through, and having the chance to become. My wife and I became certified peer counselors in 2015, and that had a lot of impact in the way that we were able to provide support and also receive it, because we are now in a space where we can speak with mental health professionals and explain what we needed and get the correct support, have relatable resources. And it was very important for us to be able to provide that in return.
That's really interesting. I know you mentioned there that your wife is also a peer. So I'm curious, what's it like being in a relationship where you're both peers and working in the space? What's that like?
Well, it's interesting. We have the opportunity to understand each other more. We grew up together, so we've been knowing each other for quite some time. So we know what each other have been through in the past. So it's actually fun to see how we can support each other now that we know how, and
Yeah,
it's good for our relationship to understand what each other has went through and how we can support them, because we don't have that outside of the home. So it helps us, also helps us kind of refine our skills when we provide that support outside to our other, our clients, our who those we mentor, and our apprentices and everything else. We and our employees, we really want to model that. So we do a lot of practicing.
that's awesome and very beautiful. I think that you got to grow and cultivate that behavioral health recovery journey with somebody so close and special to you. That's awesome. Moving
Yes.
over a little bit, or shifting over into the work that you do, I just would love to hear a little bit more about what led you to start Jones Community Solutions and, kind of the work that you do over there.
Sure. So we We at Jones Community Solutions, we're a training agency. We do a lot of consultations. We do training in trauma informed care, leadership trainings, motivational interviewing, trauma informed care. We also have crisis prevention and intervention. I do a lot of legislative advocacy and forensic support because these are the things that got me involved, because these are the things that I needed. This is what my family needed. This is what my community needed, the support. We have a lot of support and a lot of organizations that do work, but they stop at a certain point. And for example, what really got me involved with the forensic side was getting custody of my children. I had to fight for custody of my older kids years ago. And I also had no support at that family reunification point. But they also have support up to court, after court, but not that part. And that's the most important part. And they didn't have representation of color as well. Um, so the things that I needed is and was not getting, I we had my family had to be very creative in how we took care of ourselves. And we shared that with the community at whole, because our community needs to take care of themselves as well. And we don't all have those services. And a lot of things start and stop at certain points. And those are very important places where we really do need the support. It might work well in one community, but another community needs a different type of support. And when programming starts and stops, there's gaps. So we've been very, very focused on filling in those gaps, providing very intentional peer support, and being directly focused on the services we provide. And it also keeps us out of competition. I don't need to compete or compare with anyone. I just need to provide the correct services.
Right. And when services, there are so many gaps in services and so many needs are still not being met, it's hard to imagine what exactly are we competing, right?
Right.
But at the same time, there's also, a limit on the available grants and other funding. So thus the competition comes in, right?
Right.
But what seems to be really missing in what you're saying here is a lacking of like a holistic approach to understanding somebody's recovery journey, right? That it's beginning to end and covers so many things, right? Things that I think a lot of people don't consider at the forefront of recovery, like housing, employment, family, right? These are things that can sometimes be periphery when we think about what's needed for recovery, but are actually so core to someone's recovery journey. But they have to, of course, be done in a way that is responsive to the culture, right? And to the community of people that come from that. So that totally makes sense, and I appreciate that.
Yes, it's true. We have to continue, like we speak of this golden thread. That golden thread has to follow through from the beginning all the way through to their journey. And this needs to be holistic. It needs to be supportive. It needs to be engaging. They need to be able to participate. And you need to leave individuals with their dignity. You can't have them feeling like they're just a checkbox for you and they're just always triggered and traumatized.
Absolutely. Absolutely. You got to support people where they're at and lift them up and not push them down, right? And it's unfortunate reality that too many in our community do think that pushing down is an effective approach. But we do know different based on
Yes.
our own experiences, right? Well, it sounds like you've done a lot of incredible work over at Jones Community Solutions, and you're addressing some really needed issues for our community. I just wanted to see, do you have like a most proud moment at your work at Jones Community Solutions? Something that you did that, that you really think helped address some of those needs or some of those gaps in services?
I'm very proud of all of the work we do. I'm very proud of my team. I have the most diverse training team. Um, they're absolutely outstanding. We it was designed purposely to provide that relatable resource. For the community. It's a very diverse BIPOC training team. I'm very proud of the work we do translating the Certified Peer Counselor Manual into Spanish so we can provide trainings into the Latin community. I'm very proud of the mentor hub my wife has started. We have been able to add 6 more trainers of color to the state healthcare
Wow.
authorities training list, mentoring them all throughout the year. And I'm also very proud right now of the work my wife and I are doing professional. We're teaching at Olympic College, and we're doing our higher education, our continued education trainings at Highline College. And I also, besides mentoring, I have an apprentice. And my apprentice now is in college. I'm putting him through college. He has a full-time job, and he's getting his CNA He's getting his college, and he's working, and he's of color, and he's the only one. And I'm very proud of how happy he is.